Cosmetic injections are marked as routine beauty fixes, but according to reporting by the Times of London, they are leaving some women hospitalized and, in rare cases, fighting for their lives. The Times reports that hundreds of women in the UK have come forward with claims of severe illness after anti-wrinkle treatments, including cases of a potent and potentially deadly form of poisoning. One case highlighted by the Times report is that of a 52-year-old former weightlifting instructor from London. She is described as now spending much of her time in darkness, coping with intense and persistent pain following a cosmetic injection received outside the UK. The paper reports that Maria traveled to Hungary for an injection to treat a line between her eyebrows. Shortly after that procedure, she developed serious symptoms consistent with poisoning, reportedly. According to the doctor cited by that report, the dose administered was twice the recommended level. The report says access to the antitoxin was delayed and she continues to experience long-term effects, including partial facial paralysis. The Times notes that her case is not isolated. It reports that UK health data shows 41 cases of such poisoning in England between June and August this year, all linked to botulinum toxin products used for cosmetic purposes. Some patients describe flu-like symptoms, facial weakness, breathing trouble. In several cases, investigators suspect the use of unlicensed or unbranded substances. According to the report, the Times says medical professionals and regulators are increasingly concerned about the industry. Experts quoted in that article warning that risks are increasing due to a surge in unlicensed practitioners, self-injection kits sold online, and cosmetic tourism, where patients travel abroad for cheaper procedures that may lack oversight or proper dosing controls. Survivors described in the report continue to suffer from fatigue, chronic pain, headaches, in some cases reportedly lasting paralysis. The Times also highlighting the emergence of campaign groups which bring together those affected and warns about the potential dangers of anti-wrinkle injections. The group argues that even a single dose, including those given in reputable clinics, can, in rare cases, have devastating consequences. In response to the growing concerns, the UK government has introduced new requirements for face-to-face consultations before prescribing the dermal fillers. A broader licensing regime for cosmetic injectables has been announced, but is yet to come into force. Meanwhile, authorities have launched criminal investigations into the use of unlicensed products, following a rise in hospital admissions. As the report makes it clear, what is often seen as a quick cosmetic procedure can carry serious and sometimes life-changing risks. To stay up to speed with the latest news, download the WION app and subscribe to our YouTube channel.